Good afternoon, and thank you for joining us here today. I want to acknowledge that we are gathered on the traditional territory of Treaty 6, and also to acknowledge the Métis people who share a deep connection to this land. My name is Rakhi Pancholi. I'm the MLA for Edmonton-Whitemud and the official opposition critic for Children's Services. I'm joined this afternoon by my colleague, MLA David Shepherd, the critic for Health, and we're also joined by Lindsay Kemp, a parent and a constituent of mine, but a parent of a child who is a frequent visitor to the Stollery Children's Hospital. We know there is a crisis in our healthcare system and that Alberta's dedicated frontline workers are doing everything they can to care for patients amid the chaos and the fatigue. Here in Edmonton, the Stollery Children's Hospital has seen estimated wait times reach as high as 16 hours, while in Calgary at the Alberta Children's Hospital, AHS has had to bring in a trailer to triage patients for the emergency department. Meanwhile, parents are doing their best to keep their children at home and to care for them at home and to keep the pressure off of the healthcare system, but they're struggling to find children's Advil, Tylenol, amoxicillin, and other critical medications. Just a few days ago, Alberta's new Chief Medical Officer of Health wrote a letter to parents that was distributed by all the province's school divisions, warning that this flu season could be, quote, more severe than we have seen in years, end quote. We cannot wait for wave after wave to hit us. Albertans need action now to ease the chaos in our healthcare system and the unimaginable stress and anxiety that it is inflicting on Alberta's dedicated healthcare workers. As a parent of young children myself, I too am doing my best to keep my children healthy and out of the healthcare system, but that hasn't stopped the flu from hitting our house. Unfortunately, both my children were sick, but fortunately they weren't very severely ill, and we were able to care for our children at home, although they did miss 2 weeks of school. But we are so fortunate to have children who don't have underlying medical conditions that would compromise their ability to cope with every virus or flu that is coming their way this winter. Alberta parents and children are facing difficult choices. Too many don't have access to a family doctor. They can't find the medications they need to care for their children properly at home, and they're terrified of having to take their children to an emergency room where the wait times can be unimaginable. This is why today I intend to bring forward an emergency motion in the Legislature so we can debate and discuss how to address the crisis in children's health care. I'm now going to turn it over to Lindsay, who will share some of her concerns about the state of children's health care right now.
Thank you, Rakhi. I'm here today because I am concerned about the crisis we have in our healthcare system. And I'm hopeful that maybe my words will have an effect on some people so that they realize how severe the state of our healthcare system is right now, especially the challenges confronting pediatric hospitals. Unfortunately, COVID seems to have divided society and people don't really see the big picture anymore. I think a lot of people aren't afraid for themselves about what viruses are out there or how devastating it might become for our healthcare system, perhaps because they have not been impacted personally by the challenges facing our hospitals. Our son George is 6.5. He has had 2 heart transplants and he has Crohn's disease. We are regulars at the Stollery Children's Hospital and we have been for the last 6 years. Between going for monthly IV biologic treatments for his Crohn's, blood work multiple times a week sometimes, heart transplant clinic every few months, ultrasounds, echoes, ECGs, picking up medications, and routine cardiac caths to check for rejection, we are at the hospital multiple times a month. When we are there, we talk with our doctors and our nurses, and we see the true reality of a system stretched to the limit. If you are fortunate enough to not be in that environment regularly, it's easy to not be aware of how dire the situation is. Our doctors have expressed concern and reached out to the Stollery families directly to be extra vigilant right now because space is limited for children, staffing is low, and equipment is running low. Playrooms are being used as patient rooms, elective surgeries are being cancelled, kids needing cardiac care are waiting for transfer, and teens needing ICU care are most likely going to go to the adult wards. I am very worried for kids like George. Right now, he is doing great. He is in grade 1, and it's the longest healthy stretch we have ever had. He loves to ski, he skates, he swims, and he loves playing with his friends. We lived in the Stollery Hospital for over a year between his 2 heart transplants. He fought hard for the normal life that he has right now, and I've come to realize what a precious privilege good health is. Because George is immune compromised, viruses hit him much harder, and he's been hospitalized before because of viruses, whether needing oxygen support, extra fluid support, etc. I know the dedicated staff at the Stollery and every other hospital in Alberta do everything they can to make things work, but healthcare workers are being stretched to the limits right now, and it is terrifying. I am concerned that if George gets sick and needs care, what will that look like? Will it be timely? What about the parents who are living in the hospital right now? We lived there for 7 months waiting for George's second transplant. What if they have to pass up an organ transplant because there are not enough beds or staff? Obviously, staff will do everything they can to avoid these extreme scenarios, but the fact that these conversations are already happening is unacceptable. But that's the reality we are in right now. But how do we get people to care? If I could get any point across to Albertans, it's that this is about so much more than getting sick and needing to get in the ER. There is a devastating trickle-down effect that will impact families needing access to timely health care. You never know when you may need the hospital, whether an unexpected illness, a chronic illness, an accident, whatever it may be. As a parent, I don't want to have to worry about whether there will be enough space at the hospital, if my child will be transferred, or will he get timely care. Before COVID, when George was diagnosed with heart failure, the very first teachings you get when you are admitted to the hospital is how important it is for family and friends to get their flu shots, are up to date on vaccines, and to stay away when sick. No questions asked. This was never political. This was science. We listen to our doctors because they know what is best for the safety of our child. We are now part of a vulnerable population, and this is what you have to do to stay safe. It was a new way of life. When we were at the hospital with George while he was waiting for a transplant, it was common practice that you stayed home if you were sick, you wore a mask if you had to go to the hospital, because there were very ill children there, and you didn't want to pass anything on to them that could complicate their health further. My plea is for Albertans to have some compassion and understand how your actions affect others. The people around you might look healthy, but there are vulnerable people in our society. No one is asking you to mask all the time, but just put one on if you're sick, or even better, stay home. Get your vaccines. It's simple. Your choice can make a huge difference for everyone in our society who are not as lucky to be in good health, people like my son, George. I know if we really want to solve the challenges in healthcare, we need the government to support our healthcare workers. There's no easy answer, but I hope the government will support the opposition's motion this afternoon for an emergency debate on children's healthcare. And I'm sure most Albertans would like to hear what they have to say. Thank you.
Thank you, Lindsay, so much for sharing the story, and thank you for giving us an update on how George is doing. I personally care a lot about George, so that's great to hear. But I think a lot of Albertans have the same questions and want to hear what the government has to say, and we're hoping that they'll support our motion today to have a debate in the legislature to address what's going on in children's healthcare, which is a real crisis. And we think that's our number one priority right now, as Albertans should be caring for the healthcare of our children. So I'd like to open it up to any questions now if anybody has any.
Thank you, and just a reminder that if you're on Zoom, it's the raise hand function, and if you're on the phone, it's star 9. We'll go to questions in the room. Seeing none, we'll go to the phones. Seeing none there, that concludes our press conference for today. Thank you.
So much for watching, and to learn more, check out albertasfuture.ca.